Focus to the health sector, and our correspondent Idong Joseph captures the key highlights in this package.
One of the most pressing issues in Nigeria's health sector is the persistent threat to infectious disease outbreaks. The government has worked to strengthen disease prevention strategies by expanding the capabilities of the National Center for Disease Control.
Since President Bola Tinubu took office, he has pledged to improve the health sector, from addressing the issue of brain drain to investing in health infrastructure. Over the past 18 months, there have been significant developments, but also there have been notable challenges within this period.
Mpox situation.
Regarding Mpox, while it remains a threat with about 118 confirmed cases and no deaths across 28 states and the FCT, in August 2024, Nigeria became the first African country to receive 10,000 doses of Mpox vaccines donated by the United States to combat the outbreak. Similarly, in October 2024, the Nigerian government received its first delivery of over 800,000 doses of malaria vaccines, which are intended to enhance existing interventions.
We actually saw COVID really talking around how do even people access vaccine. We know the likes of South Africa couldn't even have, which have developed economy than us. I think the minister and also his team, you can give them an edge that they are actually doing something in that regards.
Despite these efforts, diseases like cholera remain persistent. In the first 9 months of 2024, Nigeria reported over 10,800 suspected cholera cases, resulting in 359 deaths, largely due to inadequate sanitation and healthcare access in rural areas. According to UNICEF data, Nigeria's maternal mortality rate witnessed an improvement, with 41 deaths per 1,000 live births, with 1,047 deaths for every 100,000 women who gave birth in 2024. This indicates a reduction of about 27% in infant mortality and 43% in under 5 child mortality over the last 3 decades.
In the likes of Lagos, they are actually at par with actually even developed countries. When you look around their indices around maternal mortality, around infant mortality, very, very high. You can see those numbers are very low in the sense that you can compare them to the UK and key other countries. But also on the other side, when you look around also, our key mortality rate in the likes of the Northwest, the Northeast, is actually very, very high.
As of the second quarter of 2024, the National Health Insurance Authority reported that about 18.7 million Nigerians are now covered by health insurance. However, a poll conducted by NY Polls in November 2024 revealed that only 19% of adult Nigerians have health insurance, indicating that 79% pay for health care out of pockets, a far cry from the desired targets.
Imagine the population of 230 million Nigerians, so you can imagine less than 10% people are accessing this health insurance scheme. So we have to do more to make sure there are more enrollees.
In November 2024, the UK House of Commons Library reported that approximately 22,851 Nigerian healthcare workers, or 1.5% of the NHS workforce, are employed in the UK, making it the top destination for Nigerian medical professionals. In response, the government introduced a national health workforce migration policy in August 2024 to combat the brain drain and encourage professionals to return. However, Many experts believe these measures are insufficient to stop the migration.
We are not saying that we should meet up with the same exact amount they are paying in places like Canada, like US, where people are going to. Of course, we know that Nigeria is still a struggling economy, but we can, do something, fashion out something that is better for all cadres of health workers. It will stem this tide of Japa syndrome.
In August, a significant industrial action that surprised the health sector was a 7-day strike organized by the National Association of Resident Doctors. They were demanding the safe release of their colleague, Dr. Ganiat Pokwola, who had been kidnapped in December 2023, an incident the federal government described as disappointing.
If doctors keep on working, and then we get abducted every now and then. For one who has been abducted, you don't know what the person's fate is, you don't know what the outcome is going to be. And then we keep on working. That means that the environment is not conducive.
After spending 10 months in kidnappers' den, Dr. Pokwola was released in October 2024. From improving infrastructure to tackling mortality rates and addressing the medical brain drain, the next few years will be critical in determining whether the reforms and investments by the government can truly transform the nation's health system. In Abuja for News Central, I am Idong Joseph.
A very comprehensive report there. Thank you very much, Idong.